Biopsychosocial factors influencing patient and family caregiver adaptation during the hospital-to-home transition in type 2 diabetes mellitus.
Hello everyone and welcome to our presentation. Our research proposal is titled Biopsychosocial Factors Influencing Patient and Family Caregiver Adaptation during the Hospital-to-Home Transition in Type 2 Diabetes mellitus. My name is Stephanie and together with my classmates, we are going to present our complete research proposal. This study focused on how biopsychosocial, and social factors affect how patients with type 2 diabetes mellitus and their caregivers adapt after leaving the hospital and return home. Now, let's begin with the reference framework presented by Laura.
Our problem statement explains that type 2 diabetes mellitus is one of the most common chronic diseases around the world. After leaving the hospital, patients face many challenges that are not only medical, but also psychological and social. During this time, both patients and their family caregivers must manage treatment, emotion, and daily routines. However, many studies focus mainly on clinical aspects and ignore the interaction between biological, psychosocial, and social factors. Our research question is, what biopsychosocial factors influence the adaptation of patients with type 2 diabetes mellitus and their family caregivers during the hospital-to-home transition? The justification is that understanding these factors help create better nursing intervention. This intervention can improve the quality of life of patients and caregivers. Our general objective is to analyze how biopsychosocial factors influence adaptation after hospital discharge. Our specific objectives are: 1. To determine the association between biological, psychosocial, and social factors and the level of adaptation, and the second, to evaluate the impact of these factors on treatment, adherence, and self-care during the first 6 months after hospital discharge. Now, Karen will present the theoretical framework.
Our research is based on the biopsychosocial model proposed by George Engel in 1977. This model shows that health and disease are the result of the interaction between biological, psychological, and social dimensions. First, the biological dimension includes glycemic control, comorbidities, cyclical limitation, and knowledge about the diseases. Studies show that poor management of these factors is related to low treatment, adherence, and more complications. Second, the psychological dimension includes motivation, depression, and self-efficacy. When patients feel capable and supported, they manage their condition more effectively. Third, the social dimension includes family support, community, resources, and communication. With healthcare teams, strong social networks help patients are better and avoid three dimensions. By integrating these three dimensions, our research adopts a holistic view of patient adaptation after hospital discharge. Now Valentina will explain the methodological framework.
Our study used a descriptive and correlational design with a quantitative approach, complemented by qualitative data. The design is non-experimental and cross-sectional. We will collect data through surveys and semi-structured interviews. Our populations include patients with type 2 diabetes mellitus who have been discarded from the hospital within the last 6 months, and their family caregivers. We will use non-probabilistic convention sampling, include about 50 patients covering pairs. The instruments include, first, a sociodemographics and clinical questionnaires. Second, the Diabetes Empowerment Scale, short form. Next, the MOS Social Support Survey. And finally, a semi-structured interview guide for experience and perceptions. The procedures involves abating ethical approval, recruiting participants, applying the questionnaires, and analyze quantitative and qualitative data. Now, Daniela, we will talk about ethical considerations.
Our research will follow the ethical principles of the Declaration of Helsinki and the Colombian Ministry of Health Resolution 8413 of 1993. We will ensure participant rights, confidentiality, and autonomy at all times. Each participant will sign informed consent before data collection. All information will be stored securely and used only for academic and research purpose. No personal data will be shared. This ethical practice warrants respect, integrity, and the protection of every participant. Now, Gabriela will close the presentation with our conclusions and reference.
In conclusion, a reference. In conclusion, this study aims to understand what biological, psychological, and social factors influence adaptation in patients with type 2 diabetes and their caregivers during the hospital to home transition. By identifying these factors, nursing and healthcare professionals can design better intervention that improve quality to life and self-care and treatment adherence. By our proposal will contribute to more integrated and culturally sensitive nursing practices in Latin American context. Some of main references include Israel, Hirschman, Mashal Shine, and the World Health Organization. Thank you very much for your attention, and we hope you enjoyed our presentation.